I'm Beatrice. I'm from the Hepatitis B Foundation. Thank you so much for joining us today. And we are just going to give a brief overview of the All of Us Research Program, which is an initiative of the NIH and an effort to kind of increase diversity and inclusion in health and medical research and to improve precision medicine, and also touch on how this relates to efforts to eliminate viral hepatitis by 2030. And the timing sort of coincides with World Hepatitis Day, which is happening next week on Wednesday. And just to kind of talk about how the efforts are interrelated and tie them together. So we can go ahead and get started.
Sure. Thanks, Beatrice. So, Dr. Saltman, this is great. I love a one-person audience, so I could just say your name. So just to give you a little more context, so Hep Free Hawaii works with Beatrice's organization, the Hep B Foundation, as one of the outreach partners for this national campaign, the All of Us project, research project. And so basically what she was saying is that this project is like a long-term ongoing research project to increase the diversity of participants in research, both racially and socioeconomically, so that there's a wider breadth of research that's available for folks so that they can really provide precision medicine for our folks. And in particular, Beatrice and I are focusing on Asian Pacific Islander communities, just given the Hep B and the overlap with that. So I won't read this to you, but really it is like an ongoing research initiative, and we are trying to recruit folks to join at the individual level. And so we're one of those outreach folks. I think Hawaii also has Waianae Coast Comp as their new outreach partner to kind of reach out to our local communities as well.
And it's not about hepatitis necessarily.
Yeah. I mean, it has impact for hepatitis just because the data that will be gathered will have implications for, anything related to liver cancer, hepatitis itself. Chronic disease and obesity are something that our communities see a lot in addition to hepatitis B oftentimes. So fatty liver. So it does have all those implications, but not specific for hepatitis B. I think, Beatrice, you want to do the next thing then?
Yeah, absolutely. So this is just kind of a short sort of PSA announcement that just kind of summarizes the program. So we'll just play it real quick.
All of the people will come to speed up what we can learn about health. The All of Us Research Program is calling on 1 million joiners as we try to change the future.
Oh, Beatrice, I think the sound is a little choppy.
Oh.
Yeah. I don't know if Dr. Saltman, can you hear it?
Not really.
Oh, I'm sorry about that.
Okay. That's fine.
Okay.
I get the lay of the land. I'm a big picture guy.
Perfect. Okay, we can put the website in the chat too, and that has the video on it too, so you can see that as well.
Yeah. And this actually speaks to what you already talked about, Dr. Saltman, but just really some of the questions that the research might help to answer. And so you can see kind of how broad it is. So it can touch on dementia, it can touch on chronic pain, cancer, of course, as we're talking about hepatitis B, and diabetes and chronic disease, as I mentioned as well. But they're really looking at so part of it is that they're looking at health data, but they're also looking at risk factor and social health data. So there's kind of like a twofold collection or data collection component. And I think we're going to kind of share a little bit more about that, but just kind of show some of the breadth of the research that's included when they talk about, this particular project.
Yeah, absolutely. So kind of following up on that. So some of the things that sort of make this project unique are the levels of diversity at which they're trying to include people. So they're trying to recruit 1 million total people. I think right now the number's at about 350,000. And so trying to get people from different demographic areas, so including things like employment and education status, income, things like that. Geographically, both throughout the country and people who live in like urban and rural areas, whether they live near parks, near highways, sort of all that kind of information, clinical factors, as is typical, and and then especially to recruit those who are typically underrepresented in this kind of research. And then, as Thaddeus was saying, different diversity in terms of the type of data collected. So it includes body measurements, biosamples, and all the typical health data, but also environmental factors and lifestyle factors, socioeconomic and family history. So really trying to get a holistic picture. And it's very participant focused. So people who participate are really kind of viewed as partners in the research and can help inform sort of future directions and data that's collected and are really included in the entire process. And people can have access to receive all of their data and information back. So they're really kind of in control for sure. And it's a nationwide resource, and it's open to the entire public and to researchers everywhere as well. So looks like we have one more participant, which is cool. So it's a really great resource all around, and everyone can participate. Also, one question that's frequently asked is if you have to be a citizen to participate, and you do not. So anyone residing in the U.S. can participate, and it really tries to integrate with other research studies as well. It puts a premium on knowledge and health data across the board to really try to improve, to make medicine more precise and equitable all around. So.
Yeah, thanks, Beatrice. And I'll also note too that we know that other community members, including especially like Papa Ololakahi, is doing work on their own kind of like Hawaiian genomics. So this is in no way intended to supplant or supersede any other community-based kind of research equity projects, but really just to kind of supplement it so that folks will have an additional database to draw from. So just kind of wanted to note that as well.
Absolutely.
Yeah. So this is kind of, so again, like we are working on this locally and nationally with our different community members to promote individuals to join the All of Us Research Project. So I've joined it, but just kind of share a little bit of some of the benefits for an individual who wanted to join. So first of all, you can have impact for your community. You can ensure that your community is represented in research, I think, which is really important, I think, for at least for me. It also helps in terms of like, if you think about for parents or people who are looking for future generations, this is really going to contribute to the body of research available for future folks for precision medicine. You do have access to your own data. And as Beatrice said, participants are intended to be collaborators. I'm going to, even though it's the last note, I'm just going to note now, it is confidential. So they really practice the highest degree of NIH health confidential security. And I believe they even hire people to try to hack their own systems on an ongoing basis, just to ensure that the data is truly secure. So if you imagine all the levels of security that NIH already puts into place, it's that plus that extra level, just to ensure folks who are giving their data voluntarily. And that's the other thing, it is voluntary. People can choose to provide as much or as little data as they want to share. So whether it's health records or whether it's just like completing the surveys on, like socioeconomic factors, it's all up to the person. Also including biosamples if they decide to provide biosamples. All of that is up to the person. If they decide to, they can also participate long-term, so continue to contribute over many years so that folks will have longitudinal data to kind of show changes over time. So it's just kind of some of the highlights for people who do choose to participate. And I think Beatrice is going to share a little bit about benefits for providers and possibly researchers, I think.
Yeah, absolutely. So yeah, so just kind of for healthcare providers, the hope is that over the course of the study, there'll be more evidence that emerges and better, more refined and evidence-informed guidelines that can really help precision medicine come to be and to just improve the whole entire healthcare process for people and for various health conditions. So there can be, again, kind of a better understanding of holistic health and how all the different factors of life really determine a person's health and well-being, and how healthcare decisions can be tailored to them. Also, better knowledge of different risk factors that may be unique to particular communities or individuals, and response to treatment, and how those might differ among different populations. So one example of that is the heart medication Plavix, which has been found to be far less effective in Asian and Pacific Islander communities than in non-Hispanic white communities, for example. And the reason why that is largely unknown. So that's one of the questions that this project hopes to answer. And more information about how different conditions develop in different people and communities. So to allow for earlier detection and treatment. So certainly for very relevant to hepatitis B and C, earlier detection can help to mitigate the onset of liver cancer. And this is the case across the board with a variety of conditions. Just kind of different categorization of conditions and a better understanding overall. And also better sharing of data and knowledge, as we kind of touched on before, so that people don't necessarily have to be responsible for remembering their entire health history, and there can just be a better kind of collection of information that's easily accessible to different providers and communities. And ultimately, this will be used to kind of close some of the pretty stark health disparities and inequities that exist in terms of different health conditions and length of life, et cetera. So a lot of really good potential.
And this is just, I had already mentioned this, but to share with you folks again. So participants individually can submit as much or as little information as they want. So they do have to enroll and consent. They can authorize their electronic health records to be kind of linked up so they could share that. The other thing is survey. So that's really talking about, like lifestyle behaviors, risk factors. They can choose to do biometric stuff. They could provide physical measurements or biosamples. So in Hawaii, we don't necessarily, I think, have the blood draw specimen parts yet because we're so far away from their lab centers, but we can do saliva swabs for those who want to contribute that. And then there is some funding that they have for wearable and digital apps to kind of track things, like heart rate or steps and things like that. Dan, were you about to, did you raise your hand?
Question. So the Cancer Research Center has been collecting blood samples for 30 years that they have on ice. That's got a lot of ethnic diversity in it. Do you know what their role in this is? And the other local organization I was thinking of was that Kuakini longitudinal study that followed Asian American, mostly Asian American. It was Asian and Asian American. They were able to demonstrate the difference in lifestyle between people of similar genetic backgrounds, but who moved to Hawaii and lived a different lifestyle. But that's been going on. That's also been going on something like 30 years now.
Yeah, so this is like in supplement to that. So this body of data will be available to more researchers, whereas I think the ones that you're talking about are more for their researchers who are doing it. I don't know if it's necessarily like open access to other researchers. So I think that's the point of all of us is to create a larger body for more researchers outside of specific academic or like research project settings. So I think the alignment with that is really important for sure. And that's why I kind of mentioned earlier, like some folks are doing like their own genomics research for particular communities. So again, this isn't intended to supplant or like absorb all of it. It's really just like a supplement to it. But that's definitely a good point because there's so much stuff happening around research. Beatrice, do you want to kind of mention a little bit about, oh yeah, I think this speaks to that too, but go ahead.
Oh, yeah, absolutely. So again, this just kind of goes back to the similar points we had mentioned before, just about kind of understanding the whole person and all of the different factors, especially, in recent years and decades, just more and more has emerged about how it's much more than physical health, and many different factors affect a person's life and well-being. So this project really tries to incorporate all of that. And again, a participant in this program can certainly contribute as much or as little as they choose for this. So just kind of reiterating that point.
And Dan, this actually, it's like Dan has a foresight in terms of this presentation, because this actually speaks a little bit to what you're already talking about in terms of Asians and Asian Americans. So as Beatrice and I were kind of noting, our outreach focus is Asian Americans, Pacific Islanders, and Native Hawaiians, just to kind of ensure that they are part of the larger body of research. So, and this kind of speaks to that, right? So currently, when we look at the health data pool for research, only 5% are really accounted for, or include Asian Americans and Pacific Islanders, and they also include Native Hawaiians in this, only make up 5%. So imagine all the technologies and all the medications that are being developed, but that aren't really representing the communities that are being served. Kind of like what Beatrice was mentioning about the Plavix medication, right? So that's why we're really trying to intentionally engage our communities that we work with to ensure that, the average person, right, includes AAPI people and Native Hawaiian people. So really just, again, kind of harkening back to that idea of precision medicine for our different communities. And, we're wrapping it up. So I think Beatrice is going to show the relevance to our work, and then we'll just open it up for any questions. So
Yeah, absolutely. So yeah, we just wanted to connect it to World Hepatitis Day since it's approaching. And so particularly since hepatitis B really has a disproportionate impact on AAPI communities, mainly due to kind of lack of services in home countries. So this kind of highlights one of the health inequities that all of us is attempting to close, or one of the disparities that they're working on. And so yeah, really trying to make sure that community members are more informed about different health conditions that can affect them, and are part of the conversation and engaged in the health of themselves and their communities, both now and for future generations, and that all available resources are accessible to different communities that are traditionally underrepresented, and also that healthcare providers have more knowledge to be able to better make decisions, from prevention and diagnosis to treatment and management of different conditions, and that the tools are available to them to make that happen. And the goal of precision medicine and really tailoring healthcare to individuals, that is kind of the hallmark of all of us, is also kind of goes in tandem with the goal of eliminating hepatitis by 2030, and working kind of on all levels, but also on the level of the individual and the provider, to increase awareness and knowledge, and kind of move forward to a world that is free of disease, and where everyone has the opportunity to be healthy and live a long life. So that is it. Thank you so much for attending, and we can take any questions that you might have. I will stop sharing.
So any other questions, Dr. Saltman or Keikoa?
How old is this?
I think it was started in 2015. Does that sound right?
Mm-hmm. I think so, yeah.
Yeah.
And it's slowly scaled up nationally as they're trying to build more community engagement. So it's continuing to grow over time. I don't know like how much how many more partners are joining, but I think they're still recruiting, right? I think they're still getting a lot more folks involved.
Yeah, I think they're continually trying to scale up efforts. We're working with the Asian Engagement and Recruitment Corps in Chicago, but I think that they have like pockets all over the country of different groups that are working in different areas to increase participation. So.
And what's pharma's role in it?
So pharma is it's an NIH grant, so it's not funded through pharma, but I think pharma will probably have access to, as researchers, to the data, as will anyone who's a researcher. So that's what I imagine their role to be in terms of like medication development or something like that.
And so that involves a kind of recruitment from this pool of participants in drug studies.
Right. So so folks can participate as much as they want. So it could just be looking at like longitudinal health data that folks are just submitting passively, but there are opportunities for folks if they want to get more involved, if they hear about like drug studies or something like that. So yeah, it's not necessarily that they will recruit these folks for a study. It's that they'll draw from whatever the data pool of what folks have contributed already. So it's a little bit more passive in terms of what they're doing.
You wouldn't be able to answer that Plavix question without something like that, though.
No, so it's kind of like one of those things where like they look and they're like, okay, this is something that's happening. What can we draw from this? And then they'll probably set up some sort of recruitment, not necessarily through all of us, but it could be. I think they might. I think there are opportunities for folks if they identify like someone who's in particular, of what they're trying to look for.
Mm-hmm.
Yeah. Any other questions? Happy summer then, because
Yeah.
we
And
appreciate. Go ahead, Beatrice.
oh, I put the website in the chat, so you can feel free to take a look at it and check it out for more information as well.
Thank you, Beatrice, for setting this up. Beatrice
Yeah.
is on the East Coast, so this is the end of her day. It's the morning of ours, but also thank you, Dan and Kikor, just for joining and spending your time on a summer day with this.
Thank you
But if
so
you have any
much.
questions, yeah, reach out. And thanks again, Beatrice, for setting this up.
Yeah, my pleasure. Thank you so much, and have a great rest of the day.
Thank you.
Bye. Thanks, everyone.
Bye.